Hi, I'm Dr. White, and I do things somewhat differently. I believe in precision surgery. I don't promise perfection, but I won't quit until it's as good as your body allows me to get it at that time. Exceptional results can be achieved, but it requires different techniques and a willingness to take the time necessary to get that extra special result. If you apply precision surgery and take the time to do a better operation, what I have found is that you can have less tissue trauma, which means less bleeding, less bruising, typically no bruising, less pain, and easier, faster recovery, and better results with less chance of a problem. And I believe it's worth the extra effort. In fact, most of my patients are off pain pills in one day. And they're only taking Tylenol the day after surgery with very little, if any, bruising, which is really surprising if you think about it. Doing one thing well is not that hard to do. Doing everything well is extremely difficult. That's a bit of a bold statement. I learned many years ago that if you're going to do something, do it right or don't do it at all. And I've dedicated my life to being the best that I can be. Let me help you understand how I got there. I was very fortunate to have been selected to work with Dr. Denton Cooley, one of the most famous surgeons in the world, while I was still in college. And at that time, I got to operate at the Texas Heart Institute all day, every day, for an entire summer. And it was really fun because I learned not only how to close the leg, but also first assist and cannulate on the heart. And it was just a remarkable experience for a college student. I learned how to operate before I ever went to medical school. In fact, I'll never forget the day when I was operating with Dr. Cooley, and he was wearing a headlight, and they took the veins from the legs to bypass the heart, and he looked down, and his headlight went up and down the leg, and he looked to the nurse and he said, "Who sewed that up?" And the fellow that was there looked at Dr. Cooley and said, he did. And Dr. Cooley was quiet for a minute, and he says, "Well, good, that's the way I want it done from now on." And I thought, wow, what a great moment. So it was a tremendous experience to have learned from one of the best in the world. Later, when I went to medical school at Baylor College of Medicine, I had an opportunity to work with many world-renowned surgeons, including Dr. DeBakey, Michael DeBakey, the other most famous heart surgeon in the world. And so I knew early on that I wanted to be a surgeon. But I also knew that I wanted to do plastic surgery, because to me it's the perfect blend of art and medicine. And I felt that the best training for plastic surgery was to become the expert on the head and neck and facial plastic surgery before I went on to learn about plastic surgery for the rest of the body. And that's why I chose to do 8 years of residency to be fully trained in ENT, ear, nose, and throat, otolaryngology, before I went on to learn plastic surgery of the rest of the body. And that helped me tremendously, because ENT is focused on precision surgery, complicated anatomy, very small and delicate instruments and delicate procedures. And so that's how I was trained. And as I have evolved as a plastic surgeon, I have always applied that precision surgery to the rest of the body, and that's what has allowed me to develop innovative ways of doing plastic surgery of the face, breast, and body, and that's what makes my job so much fun. Plastic surgery is often misunderstood. Yes, of course it's about looking better, but it's about so much more than that. It's not just about looking good, but it's more about feeling good about how you look. If I can take that, which you feel is a negative, and turn it into a positive, perhaps even a strong positive, wow. That's how I make a difference in the lives of my patients, and that's the best part of my job. I'm asked sometimes, why don't you just specialize in one procedure? And yes, I could just do noses, I could just do faces, I could just do breast, I could just do tummies, but on the other hand, why limit yourself to only one procedure? To me, that it becomes more of a transaction. It's not a relationship. This is a different approach. This is more of a family practice in a plastic surgery setting. And that's what makes it so much fun, to be able to take care of the patients, their friends, and their family over time. Thank you for visiting my website. I hope you'll take the time to look at the before and after photos and read the patient comments. See what our patients have to say about their results as well as the care they received. I look forward to meeting with you so that I can better understand the changes that you hope to make. Thank you so much.